Good day, learners. I'm Ray Gapuz. I'm a test preparations coach for the last 25 years, and I've been doing coaching classes for NCLEX RN, both here in the Philippines and internationally. I'm also an author of 2 test preparations guidebooks for the NCLEX RN, which are internationally published. My Western and my Eastern education has enabled me to come up with guidelines, which I call functional concepts. And these concepts are the ones that are helping nurses to deconstruct questions on the NCLEX RN. So I'd like to share with you some of these functional concepts as we engage in our learning sessions today. Good day, learners. We're now moving on to lesson number 41. If you would ask me, what would I study in preparation for the NCLEX RN? Then one of the topics that I'd like to highlight would be the assessment of cranial nerves. Now, the last classification of cranial nerves would usually involve 4 sensory motor nerves, namely trigeminal, facial, glossopharyngeal, and vagus nerves. So these are cranial nerves 5, 7, 9, and 10, respectively. So let's figure things out. Option 1, facial. So we put a check. Yes, that's a sensory motor nerve. Trigeminal. Yes, that's a sensory motor nerve. Oculomotor. No, that's a motor nerve. Vagus. Yes, that's a sensory motor nerve. Glossopharyngeal, yes, that's a sensory motor nerve. And abducens, that's just a motor nerve. So in other words, the correct answers are options 1, 2, 4, and 5. Now, let's figure out the functions of each of the 4 sensory motor nerves and identify methods of assessing these nerves as well as associated abnormalities. So let's begin with cranial nerve 5, trigeminal nerve. So as we all know, it has both sensory and motor function. The sensory function involves sensation on the face, so facial sensation, and the motor function involves mastication or chewing. So how do we assess the sensory root? We use a pin or cotton ball and then usually run those through on the cheek, on the forehead, and on the chin, and ask the patient if they feel something. Then we also need to assess the corneal reflex, okay? Now, how do we assess the corneal reflex? We need to use a piece of cotton and lightly touch the cornea with the cotton. What is usually an expected reaction from the patient would usually shut their eyelids, okay? The associated abnormality for cranial nerve 5 would be trigeminal neuralgia. Now, trigeminal neuralgia is a condition characterized by chronic pain, and it is usually caused by a tumor that is exerting pressure on the trigeminal nerve. That's the reason why there's usually chronic pain. Now, for the assessment of the motor root of the trigeminal nerve, we ask the patient to clench the teeth, okay? And then we also need to assess the jaw jerk reflex. Now, how is this done? So we need to face the patient. We place index finger against the chin of the patient, and then we hit it with a tendon hammer. So we hit the finger with the tendon hammer, and then the result would be the jaw of the patient would slightly protrude, okay? And that's its expected. Next, the second of the 4 sensory motor nerves involves your facial nerve. So the sensory root is responsible for the sense of taste for the anterior 2/3 of the tongue, and then the motor root is responsible for the movement of facial muscles. Now, how do we assess the sensory root of the facial nerve? First, we use a cotton swab soaked in different solutions. And then we use those soaked cotton swab to introduce taste that the patient needs to identify. But we have to be careful that we ask the patient to gargle in between testing of the taste. So we could either soak the swab on sugar water and then swab it on the anterior lateral side of the tongue, and then ask the patient to identify it. And we ask the patient to gargle, and then we soak the swab again in salt water this time, and then we apply it on the lateral side of the tongue, and we ask the patient again to identify. And then after that, we ask the patient to gargle once again. Now, a common abnormality for the sensory root of the facial nerve is a condition known as ageusia, or the complete lack of sense of taste. We also have the condition known as hypoglossal, or a decrease in the sensitivity to taste. And we also have dysgeusia, or the distortion of taste. Now, dysgeusia could be associated with treatments like chemotherapy and the use of albuterol. So albuterol could potentially alter the patient's sense of taste. Now, let's move on to the motor root of the facial nerve. To assess the motor root of the facial nerve, we need to ask the patient to move the facial muscles. Now, how is that done? We first have to ask the patient to crease up the forehead or keep the eyes closed against resistance. And then we ask them to puff out the cheeks and, of course, to reveal the teeth. And we can always ask them to smile to do that. Okay? Now what condition would usually tell us that there's an abnormality of the motor root of the facial nerve? So we have a condition known as Bell's palsy. Now, Bell's palsy is characterized by a weakness of one side of the face, and usually this is temporary, and it could be related to either an inflammation or a compression of the facial nerve. This could actually affect patients from age 16 to 60 or at any age within those range. So the good thing is that this is reversible. Now, the third of the four sensory motor nerves, so the glossopharyngeal nerve, which is responsible for the sense of taste for the posterior one-third of the tongue. Now, how do we assess it? Once again, we assess it like the way how we did it with the sensory root of the facial nerve. So again, we make use of swab and soak it in different solutions, like to assess for the ability of the patient to discriminate bitter taste. We can use coffee solution, and to assess the patient's ability to discriminate sour taste, then we can use lemon solution. And if there's a loss of taste sensation to the posterior one-third of the tongue, that's considered an abnormality. Now, the motor root of the glossopharyngeal nerve is responsible for swallowing, and this is usually tested together with the vagus nerve. So we use a tongue depressor, ask the patient to open the mouth and say ah, or we ask the patient to swallow or cough. If there's a failure of the gag reflex, that's an abnormality of the glossopharyngeal nerve. Now, difficulty in swallowing or dysphagia is also a manifestation of abnormality of the glossopharyngeal nerve. The last of the four sensory motor nerves is your vagus nerve. It also has sensory roots which function to decrease the blood pressure or the heart rate. And therefore, once stimulated, we need to check the vital signs. An abnormality would be when there's increased blood pressure or heart rate. And since the recurrent laryngeal nerve actually divides from the vagus nerve, so affectation of the recurrent laryngeal nerve could actually cause hoarseness. So if a patient has hoarseness, it's the vagus nerve that could be affected. So the motor root of the vagus nerve is actually responsible for the muscles for swallowing and speech. Now, assessment would be just like that of your glossopharyngeal nerve. We actually elicit the gag reflex using a tongue depressor, and we note for swallowing difficulty and the failure of the gag reflex. Okay, now let's use the knowledge we just learned to answer a question. Here's a sample question. Hoarseness results from damage to which of the following cranial nerves? Is it 1, oculomotor? Option 2, the optic nerve. Option 3, the facial nerve. And option 4, the vagus nerve. Now, we've learned a while back that hoarseness could be associated with the affectation of the recurrent laryngeal nerve, which divides from the vagus nerve. So the answer is option 4, the vagus nerve. Now let's highlight. I know for a fact that after going through all those 12 cranial nerves, sometimes we kind of mix up things and it's difficult for us to recall some similarities in terms of the functions of these cranial nerves. So let me highlight some of these things. Now let's differentiate cranial nerves 5 and 7. So both are sensory motor nerves. Let's take a look at cranial nerve 5. The sensory root is responsible for facial sensation. It's assessed using a pin or a cotton ball. And the motor root is actually responsible for chewing, and it's assessed by asking the patient to clench the teeth. For cranial nerve 7, it's also sensory motor, so it's a mixed nerve. So the sensory root is responsible for a sense of taste, It is assessed using solutions with flavor, different ones. And then the motor root is responsible for facial movement. So it's assessed by asking the patient to smile or to reveal the teeth. So if we ask the patient to clench the teeth, we're assessing trigeminal nerve or cranial nerve 5. If we ask the patient to reveal the teeth, we're assessing cranial nerve 7 or the facial nerve. Now, let's also differentiate glossopharyngeal nerve, which is cranial nerve 9, and the hypoglossal nerve, which is cranial nerve 12. So the main difference lies in the fact that cranial nerve 9 is a mixed nerve. It has both a sensory and motor root. The sensory root is responsible for the sense of taste in the posterior 1/3 of the tongue, and the motor root is responsible for swallowing. On the other hand, cranial nerve 12 or hypoglossal nerve is a motor nerve, and it's just responsible for tongue movement. So it's being assessed by sticking the tongue out. Okay? Let's move on to a functional concept. The sense of taste is related to the functions of the following cranial nerves: the facial nerve, the glossopharyngeal nerve, and the vagus nerve. Now remember, the vagus nerve has a special sensory function as it provides taste sensation behind the tongue. For the anterior 2/3 of the tongue, the taste sensation is actually related to the function of the facial nerve. For the posterior 1/3 of the tongue, it is actually the function of your glossopharyngeal nerve. So once again, it's shout out time. Congratulations to a lady from Tarlac City, Joy Añasco, USRN, for passing the NCLEX RN for the state of Texas. Once again, congratulations from your RA Gapuz family. So let's learn together. For more instructional videos, subscribe to my YouTube channel, Gapuz Mentors, and my Facebook page, Mentor Ray. If you have anything in mind that you want me to cover in my future videos, or if you're confused with some concepts and you want clarifications, please feel free to send me a note or a message through my email, mentor.raygapuz@gmail.com, and let's learn together. Disclaimer: the instructional tool is created to enable students to develop their test-taking skills. The question or questions and answers contained in this instructional video were patterned after the official publicly accessed samples from the RN test plan of the National Council of State Boards of Nursing, or NCSBN. The discussions and rationale presented in the video are based on the lecturer's research and are meant to provide an explanation for the answer or answers to the question or questions that is or are presented. The lecturer makes no claim, directly, implied, or otherwise, that the rationale discussed is officially endorsed by NCSBN.